The NHS spends billions of pounds every year on goods and services. It doesn't do it very well. It doesn't really take advantage of its huge purchasing capacity. So the e-procurement strategy provides the tools in which we can do procurement better.
So I don't want to wait another 10 years to be recognised to be world-class in supply chain management and procurement. And I think the GS1 investment is going to help us get there for the next 2 to 3 years.
Without GS1, we will not get the information that allows transparency and comparative factors to be brought into account. And I think the fact that this is now being mandated, that the health service has no option but to adopt GS1 standards, is something to be very warmly welcomed. And I certainly think that it will lead to greater procurement intelligence. I think it will help NHS organisations organise themselves more efficiently, and it will allow the benchmarking of data as well, which is to be very much welcomed.
All these trusts saying we want to buy independently of each other, they're all choosing the same products from the same manufacturer. But we're not aggregating that spend and entering into commitment-based relationships with these organisations.
We developed our own in-house catalogue and contracting system, and in 2003 we were fortunate enough to win the HSJ Awards for improving patient care through the introduction of this new technology. However, there was definitely something missing, and that is data standards. Barcodes that we were using within cath labs and other areas, different standards, no consistency along supplier records across the NHS.
I think trusts, being the organisations that they are, generally tend not to be able to move as quickly as some other sort of commercial type of organisation. So the ability to react to the milestones, the plan, the challenges that are in front of them is very important.
So surety of supply, risk, are our patients being given the right products at the right time? Are some products not arriving and we've had to cancel operations and so on and so on? It's not discussed at board level. It's like one of the most critical things to look at in any organisation.
The savings are definitely there. According to a GS1 study with the Nursing Times, a nurse spends on average an hour per shift, so searching for product and supply chain related areas. The LTH spend £1 billion with 154 million on nurses' pay, so the cost to the LTH of lost nursing time is around about 19 million a year. Within order management, between 2002 and 2010, there's been a 46% reduction in the number of order processing staff. But in terms of inventory, the savings are quite significant. In trauma, for example, we started in January 10. May 14, stock was down by 434,000. There are quite significant benefits to gain from having these systems in place, but more to the point in having the data standards and the accurate data within the systems themselves.
Before, the average time spent searching for 5 products was 6 minutes because they couldn't find anything because they stayed at the storeroom. After we'd finished, it was just 1 minute at that point. They could go in, go straight to the area, pick it up and get back out, and that's what saves the nursing time. The average time was 3.3 hours a week that they were spending in there. We put it down to less than 30 minutes now. So that's an awful lot of time that nurses are actually spending in theatre and not walking around the storeroom trying to get lost.
In the ward and clinic programme that we deployed last year, we estimated that we saved around 30,000 hours of clinical time, nursing time for the year, which equates to around 15 whole-time equivalents. It's not, the agenda wasn't to take those posts out of the system, but to make sure that we could release that time back to nursing and patient care. And I think the other benefit for us was that, as Scott said earlier, we saw a reduction in stress levels, and actually, just the general tone of the areas improved.
The McKinsey work actually estimated that for a trust of 600 beds, acute beds, an annual saving of £3 to £5 million from the application of GS1 global standards. What's in it for manufacturing industry and suppliers generally is a much more professional approach to procurement. And yes, it will drive value for money, but equally there will be much more certainty about volume or the actual amount of money being spent in particular sectors, longer term contracts perhaps, win-win approach, and also I believe that through better procurement we can actually invest much more in innovation. So there's a lot on offer for good, innovative companies.
The benefit to suppliers is they have moaned consistently about, quite rightly I'd add, about the fragmented approach of the NHS, etc. The outcome of this could be very good, mature, robust long-term relationships. So that's what I think is the key thing for suppliers that will come out of this journey.
I think in terms of the benefits for the manufacturers of rollout of GS1, I think inevitably it will help them with the costing side of their business, manage down their working capital and serve the customers in a more activity-based way. I think the other benefit that it brings to the manufacturers is that it improves the patient safety aspect of their offering.
From a strategic point of view, I think the first thing is getting on the board agenda. Trust board agendas are very, very busy. The whole e-procurement and wider procurement programme is critically important, but it's new. So it needs to be fitted into the board's agenda and priorities. Forming a single team in a trust involving clinicians, the various people involved in procurement, so that everybody's working together to make this happen to a proper project plan with proper milestones and monitoring, because this is not a quick fix. It's going to take some time, some resilience, and it needs to be very properly project managed.
The first challenge that Trust might face when implementing would be around scope definition. It's a big undertaking. You're not going to do it overnight, and you're not going to do it without understanding what are the individual steps you need to take. The second would be about engagement, and that's both clinical engagement and management engagement. So that when you're trying to change things in people's areas, there's one, support from sort of the top down, but also on the ground support, and they understand why you're doing this and what the relevant benefits are for them. And the third would be around cost. It's going to take some time, and it's also not going to be done for free. So it's where do you want to prioritise your spend or your investment to make the procurement strategy real, and make sure you focus on those areas initially.